Next on KQED Newsroom, one transit strike ends and another is averted, but tensions remain. What does it all mean for the labor movement? With the national rollout of Obamacare hobbling along, what can we expect from California's new health care exchange? And the state's top campaign finance watchdog heads to the Federal Election Commission in Washington.
We have been able to achieve consensus, and I'm hoping that we're going to be able to do the same at the FEC.
Good evening and welcome to KQED Newsroom. I'm Thuy Vu. California's top political watchdog scored a major win this week. Ann Ravel, chair of California's Fair Political Practices Commission, or FPPC, announced a $1 million fine in a case of campaign money laundering. The settlement is against two nonprofits that funneled millions of dollars into last year's election.
The nonprofits and the donors to them sought to exploit loopholes in California disclosure laws.
California's future.
The contributions were intended to help defeat Governor Brown's Proposition 30 to raise taxes and pass the anti-labor measure Proposition 32. Ravel went to court before the November election, pushing the groups to disclose the true source of the contributions. She's now headed to Washington, D.C. to serve as President Obama's appointee on the Federal Election Commission. Before Thursday's settlement was announced, Ravel spoke with Scott Schaefer about the challenges of informing voters about the flood of money in today's political campaigns.
Ann Ravel, welcome to Newsroom.
Thank you very much.
Well, the Fair Political Practices Commission, the FPPC, which you chair or have chaired, was created after Watergate. There was a lot of cynicism about politics. How do you feel the FPPC has made a difference under your tenure there to, enhance trust or faith in our political system?
The purpose of the FPPC was to enhance faith and trust. Clearly, a large percentage of Americans do not feel that trust in government. So we have made inroads, though, and I think we've provided much greater disclosure. We've shown the public that we will fight for disclosure before an election when it counts, when it makes a difference for them when they vote. We've tried to provide a lot more information online and in a way that is easily accessible to people so they know more about their government and about political activities.
And in fact, your tenure will probably be defined by $11 million contribution from an Arizona group. It was very secretly done, came just before the 2012 election. It was designed to help sink Prop 30, the governor's tax increase measure, and you went to court to try to force them to disclose the true source. What did you learn from that experience?
Well, the experience was very interesting because this group had given the money anonymously, and it was more money than had ever been spent by an outside group in a California campaign. So it took a lot of effort all the way to the California Supreme Court to find out that it had been funneled through a number of different 501c3 and c4 organizations outside of California. Under California law, if they're contributing to a campaign in California and they knowingly are giving money for political activity in California, then they do have to disclose.
Yeah. There were critics who said, what if that money had been in support of Prop 30, the governor's measure to increase taxes? Instead, it was meant to undermine it. Can you say with real honesty that the FPPC would have acted exactly the same way?
I don't think there's any question that we would have acted the same way. In that case, we were responding to a complaint that was made. It was prior to the election, so we have a policy now of getting information to the people when it counts before an election. We did probably 24 or 25 other cases that were not of the same magnitude, but also requiring disclosure before an election. And the only difference was those people complied and the Arizona group did not.
There is, of course, so much money in our politics today. And one way, some say, To fix that would be public financing, to just use tax dollars or some combination of tax money and contributions from private sources to fund our campaigns. And yet, time and again, voters reject that. It's just not popular with politicians.
Right.
Do you agree that that would be the best way to go?
I think some kinds of financing are reasonable. If you can encourage lots of donors to also give to candidates, and it's not just public financing on its own. My view is what's really left in political campaign is disclosure, and disclosure is what's important to provide.
As you go to the FEC in Washington, is that going to be one of your priorities, to improve disclosure?
There's no question. I mean, the purpose of the FEC, just as the purpose of the FPPC, is to provide information to the public, and disclosure about who's funding campaigns is essential. And while some people are backing off from disclosure, the United States Supreme Court and Citizens United supported disclosure as a very important aspect of campaign finance reform.
It upheld disclosure.
It did.
And yet the FEC has really done nothing to update those rules and regulations.
No, they have not.
Yeah. You are going from the FPPC in a state where Democrats are in control, and you, as chair of the FPPC, have been able to get things done in very little time. You're going to the FEC, which is sort of built to fail in a way. I mean, you have 3 Republican appointees and 3 Democratic appointees, automatic gridlock, potentially, and that has been the case. Why would you leave California for that kind of a situation?
Well, I think that it's true that the FEC has been known for gridlock, but there have been times when they have been able to achieve important inroads in campaign finance reform. I've had to interact with people of both parties. We have been able to achieve consensus, and I'm hoping that we're going to be able to do the same at the FEC.
Have you been preparing for this by watching House of Cards?
I think that may be a little extreme.
A little extreme.
Yes.
Yeah, but nonetheless, you're heading into the fire.
Yes, most definitely. And the FEC, after all, interacts with presidential campaigns and senatorial and congressional campaigns, so the stakes are really significant.
All right, Ann Revel, chair or outgoing chair of the California Fair Political Practices Commission, soon to be a member of the FEC. Thanks for coming in, and thanks for your work.
Thank you very much for your time.
The Affordable Care Act, also known as Obamacare, is barely limping along 3 weeks after it was first rolled out. Technical glitches are still crippling the federal website to sign up for health plans, plus lots of finger-pointing this week at a congressional hearing on the problems. But here in California, a customized system set up by the state called Covered California has been earning higher marks. It's running more smoothly than the federal system, and people are enrolling. Tonight, Obamacare under the microscope. We take a deeper look to find out what went wrong, what works, and what still needs to be done. For analysis, we're joined by Sarah Varney, Kaiser Health News reporter, Josh Richmond, Bay Area News Group reporter, and Lisa Alaferis, KQED Health editor. And Sarah, I want to begin with you. What are the current technical problems and why are they happening?
So this is obviously a massive system. It has to talk to the IRS. It has to talk to individual insurers. It has to talk to individual Medicaid systems. It has to collect an extraordinary amount of data. It has to talk to immigration, for instance.
It covers 36 states. It has 170 insurance carriers.
So it's much bigger than what the administration originally imagined, right? Originally, we thought, the administration thought that states, even if they were politically opposed to the Affordable Care Act, that they would decide that they wanted to have control over it, and so they would build it themselves. So this is a much, much bigger system, really, than I think anybody had imagined. But what you have right now is essentially the Centers for Medicare and Medicaid, which is kind of the quarterback, if you will, of this, and their players are all these individual contractors. So you've got one contractor that was hired to build the identity management system. You've got another contractor that was hired to actually program the code to run the website, just literally the opening page. You've got another set of contractors who are writing other code to try and make all of those things talk to each other. So what I think was unusual about this rollout, and I think certainly having talked to contractors who are building these systems both at the state level as well as in Washington, is that there really was not one contractor that was responsible for making sure the thing worked from end to end. That was CMS's job. And I think we can all...
And CMS is the company that was handling the...
CMS is the Centers for Medicare and Medicaid.
Okay.
So that's the federal government.
Okay.
And they were the ones that were supposed to be responsible for testing to make sure that everything moves smoothly.
And did they do the testing? Because now revelations are coming out that the testing of the system from end to end really didn't happen until just 2 weeks before the rollout, which is really not enough time to test something this massive.
Of course. Yes, the testing did not happen, according to what we heard in testimony over the last 2 days, did not happen until 2 weeks beforehand.
And why was that?
Well, let's see if I knew the answer to that question. I mean, well, first of all, so the one thing that's different about the federal website when they first decided to do this is they were going to build it using open source code, right? Because the HHS, essentially, the Health and Human Services, said we want to pay for this once. And then other states, if they want to use the federal system and import it to their own state, we don't want to have to pay for it multiple times, right? Because the federal government's footing the bill for all of this. So they built this open source system, and it has been basically much clunkier, obviously, than they imagined. I think some of these comparisons to, well, you know, FTD doesn't crash before Valentine's Day and eBay doesn't crash before Christmas is pretty unfair and pretty spurious, obviously. I mean, this is as you were saying earlier, you know, this is a system that's on orders of magnitude far more complex than anything that's really happening in the private sector.
Well, and those websites would have all had the opportunity to launch in beta mode and then ramp up slowly over time, and suddenly here we are. It's like boom, October 1st, we've got millions of consumers wanting to get information and they can't.
Right.
Of course,
and also, I mean, the other
system.
big thing here was, of course, that a lot of the regulations didn't come down until fairly recently. So if you talk to the actual contractors themselves, they would have loved to have gotten the specs for what they were building several years ago, and because of the political situation, but also because it is a huge law to implement. You know, millions and millions of decisions to be made,
Sure.
tens of thousands of regulations to be written, that then have to be translated into, okay, so what does this actually mean when we're trying to build the website? All being done, of course, whilst a presidential election is going on.
Yeah.
More recently, a government
42 votes to try and overturn the law.
You mean politics had a role in this? I'm shocked.
And so that's healthcare.gov having a lot of problems. Obviously, people are having a hard time enrolling and signing up. But here in California, we have Covered California, and that system actually seems to be running much better. Talk about that, Lisa.
That is running much more smoothly. Covered California released numbers this week saying they've had 2.2 million unique visitors. They aren't releasing, since the first week it opened, they aren't releasing any more enrollment data, but we do know that 126,000 applications have started. I've talked to people who successfully enrolled in that first week. We received an email from a viewer today who saw we were doing the show, who said, I mean, this is the story the Obama administration will love. She's currently paying more than $2,500 a month in health insurance premiums for herself alone. And she said she got on the website easily, enrolled easily, ran into one glitch, called the 800 number, got somebody to answer quickly, solved the problem, enrolled. She's now paying less than $500 a month, savings of $25,000 a year. That's a happy story. But I've also talked to people who are getting notices of cancellation of insurance, finding out they can't keep their doctor, finding out their premiums are skyrocketing. I mean, it's going to be, for the 2 million people in the individual market in California, about 1 million of them are not subsidy eligible. And what's going to happen with their premiums is going to remain to be seen. I've heard from people who literally are crying over their increases.
There's no doubt that some people are taking it on the chin, but it's worse in certain metropolitan areas than others, according to availability of services. Isn't there some element of this also that's related to their own health, pre-existing conditions, smoking habits? There's also
so smoking is not a factor in California.
It's not a factor in California.
The only things they can take into account in California are age, number of people in your household, and where you live, what region of California you're in.
And in fact,
they do take that into consideration on the federal website.
And in fact, KQED has an Obamacare explained guide where you kind of lay out all of these explanations.
Yeah, so we've produced a guide to the Affordable Care Act, which people can look up. It's you see it on screen now, kqed.org/Obamacare. It'll walk you through the health law, and you can also look it up if you're an immigrant, if you already have insurance, what it means to you.
And I want to talk for a minute about the political ramifications here too. Is there a lot of political fallout from this? Because we saw in the congressional hearing this week a lot of finger pointing by Republicans now. They're really pouncing on this. In fact, some are calling for Kathleen Sebelius's resignation, head of Health and Human Services.
Right. Yeah, it's not just the Republicans who are finger pointing too. I mean, there was some pretty stiff language coming from some of the Democrats in that hearing as well. Anna Eshoo from right here in Silicon Valley basically wanted to know why the system was not prepared for this tremendous volume of hits it was going to get. She said Amazon and eBay don't crash the week before Christmas, and ProFlowers doesn't crash on Valentine's Day. The private sector has figured out ways to handle a lot of web traffic, albeit perhaps that's a much easier transaction that some of these commercial websites handle than the tremendous amount of data that has to be gathered and then checked with various federal agencies. It may not be the most apt analogy, but there's criticisms coming from both sides of the aisle. That said, there are a lot of Democrats who feel it's a little bit hard to take when Republicans are complaining about how hard it is to use the law when they've been trying to shut down the law for the past 3 years very consistently. It sounds a little bit like hypocrisy to some people. Now, that's not to say that there shouldn't be a full explanation of why it doesn't work and when it's going to work. But there's also the element that we are now 25 days into a 6-month process. And if indeed the administration delivers on its promise to get this done by the end of next month, there's still plenty of time for people to sign up. I see you shaking your head. You don't think it's going to be done by the end of the next
skeptical,
month. Yeah.
So
well,
you are.
It's a hill to climb for sure.
I think there's a lot of political points to be made by saying, okay, we're going to have it fixed by the end of next month, and so that takes the heat off now. And then at the end of next month, if it's not fixed, there will be far bigger problems to deal with than the credibility that they made this claim that it would be fixed by now anyway.
But I think it's also important to think about how else do people sign up for health insurance. So as I'm sure as you've done, I've gone to many community clinics where you sit down and you watch somebody actually fill out a paper application for Covered California. This is an oftentimes for working families. Even committing to $90 or $120 a month in a premium, they really have to go through their family budget, make sure they have that, they're going to be able to pay for that. Right. So this is kind of like buying a car. It's an important decision that the family needs to make where they need to budget for it. So I think that in some ways, having an insurance broker or having one of these assisters who can really sit down with them in person, or somebody over the phone who can really help them walk through the process, is not necessarily a bad thing. So there certainly may be people, I'm sure, of course, there are people who want to be able to go to the website, type in their zip code, make it fast and easy, of course.
And when it works,
but I think for many people, having somebody on the phone or seeing somebody in person is a really helpful.
I don't disagree with that, but I think if you've got a website that's not working, and who are the people trying to enroll, who are sampling now, might be the young and healthy that are getting turned away. We don't know.
All right, we don't know. We don't know a lot of things still, so we will keep watching. Thank you all, Sarah Varney, Lisa Alaferis, and Josh Richmond. Still to come, a glimpse of upcoming stories we're working on. But first, as BART unions prepare to take a contract vote, a look at the role labor unions play. The Bay Area's commuters back on track after BART workers ended their strike. But did the walkout and other recent labor strife derail the public's perception of unions? We're taking a broader look. The labor disputes at BART and AC Transit have raised new questions about the role and relevance of unions in today's work world. We're seeing public anger towards organized labor, but the unions say they're fighting hard to protect decent wages and benefits. To give us historical perspective and analysis of the current state of unions, we talked earlier with UC Berkeley professor Harley Shaiken. He has studied labor, the global economy, and the changing nature of work. Professor Shaiken, thank you for joining us on the program.
Nice to be here.
Let me ask you first of all about the BART contract and the terms being offered to union workers, including a 15.4% pay raise over 4 years. What do you think of the terms? Good contract?
I think it's a very good contract. It's fair to both sides. A lot of hard bargaining got us here, but it's something in which both sides can go forward and build on it in constructive ways for BART, for the public, and for each other.
And for the first time, they will be paying into their pensions 1% per year and then rising to 4% in the fourth year. Also, health insurance premiums will rise from $92 to $129 a month. Those sound equitable to you as well?
They do. I think we have to put it in a bit of a context. For workers, they didn't receive a wage raise over the last 4 years prior to the negotiations. So it's a generous contract for the 4 years going forward, but it's also meant to pick up some lost ground where they didn't get anything.
Even with this proposal, there are a couple of things still pending. AC Transit is still in a 60-day cooling off period. And of course, this contract still needs to go before BART's unions for a vote next Friday. Any chance at all, do you think that this might be rejected, or is it pretty much a sure deal that it will get passed?
Well, there's never a sure deal. I think it's likely it will be passed at BART, given the difficulty of getting here. But the AC Transit workers turned down 2 contracts, one in July and one at the beginning of October. So it's never a sure deal till the votes are in.
You know, the BART strikes have sparked a lot of public resentment about dysfunction in general, because we also, of course, have the federal government shutdown. And some of the public anger is directed against BART management, but so much of it seems to be directed against the unions. Is that fair?
No, I think it's not fair. Part of it's understandable. People were angry and apprehensive. They're looking for someone to blame. The unions and the workers are the most immediate target, but I think it's unfair when you put it in the larger context. For one thing, BART has been a very effective system, even with antiquated equipment. For another, it is earning an operating profit today. Workers were central to both those things. So to simply blame one side for a stalemate and difficult bargaining, I think doesn't reflect the realities.
Give us some historical perspective, if you will. In the 1950s, when unions went on strike, a lot of people, millions of workers, even non-union ones, often cheered their wins, thinking that what they got today, we will get tomorrow. What's changed? Because now it seems like there's more bitterness than cheering.
Well, there's a sea change in attitudes toward unions, and that was also reflected in a lot of the anger against the BART unions. As you pointed out, in the 1950s, if the unions won something, even non-union workers were very pleased because they felt unionized workers today, us tomorrow. That was the pattern that was being set. The whole economy prospered out of that because workers moved into the middle class, had more to spend. That spending power created jobs. Now it's just the opposite for many people. They say, if BART workers or some other unionized workers have this and I don't, why should they have it? They think that their higher bar comes at their expense, when just the opposite is very likely true. If BART workers earn less, other workers in the Bay Area are going to earn even less in similar occupations.
Even so, given that public perception is what it is, do you think it will feed into broader issues like calls for a ban on AC Transit strikes, the broader issue of pension reform, and also infrastructure bonds that could affect BART in the future?
I think that all of this could have an impact in these areas, that is, the anger that was out there. But so far, it has not gotten traction, particularly with the thought of banning strikes or rearranging collective bargaining somehow. Pensions are an issue that have their own dynamics, so I don't think this necessarily will feed into it in a decisive way. On the BART infrastructure bonds, that of course is management as well as labor, but that's a bit of a question mark. My feeling is I think the anger will dissipate relatively quickly, and if the system works right, if workers and managers get together on this going forward with this contract, I don't think there'll be any traction in these areas to the anger that we see now.
All right. Well, Professor Harley Shaiken, thanks for joining us and sharing with us your insights and your perspective. Good to have you.
Thank you.
And just a quick clarification on that interview. I noticed that I asked about a ban on AC transit strikes, and what I should have said was a ban on all transit strikes. So just want to make sure that that is clarified. Finally, now a quick look ahead at some of the stories we're watching next week, and Scott Schaefer joins us now to talk about those.
Hi, Thuy.
Hi. So let's return to the top story and talk about Ann Ralvo for a minute and the major settlement that was announced yesterday.
Yeah, it was definitely a victory for her as she gets ready to leave town, but it really put a spotlight on that dark money, the secret money that comes into campaigns, not just in California, but all over the country. But the important thing about this is, although it is a victory, there's $1 million fine, we still don't know the names of the original donors, and that's really what she was after. We do know that most of them were from California before it went back east and then to Arizona and back to California. But what it points to is loopholes in California's election disclosure laws, and the legislature now needs to fix that if they want to, and there is a bill in the legislature which passed the Senate, and it's in the Assembly, so they may take that up. So obviously that's an important issue.
So bottom line, we're still left in the dark a little bit about who the individual donors are.
Absolutely. You know, the FPPC released these documents that were mostly redacted, but they were kind of sloppy. And so there were first names and addresses and where people worked. And you could sort of put things together and kind of draw a lot of inferences about who these folks were. And some of them are well known. But you know, in terms of certainty, you really couldn't say for sure who those donors were.
And turning now to local elections, November 5th, big controversial issue on the San Francisco ballot, Props B and C having to do with development along the Embarcadero, the waterfront.
Exactly, and next week we're going to be covering that. Cy Musiker will be doing a story for that on KQED Radio. Big issue about waterfront development, where to build, who to build for, luxury housing, who can afford to live in San Francisco, and where should housing be. And so they're going to be, we'll be talking about that. It's kicking off weeks of coverage on KQED about affordability and the cost of living in the Bay Area.
And just real quickly, you interviewed Mark Benioff, CEO of Salesforce,
Yep.
And that will air on NEWSROOM next week?
That'll be on next week, talking about his company and also his philosophy about philanthropy in Silicon Valley and in the high-tech sector.
Okay, we look forward to that. Thank you, Scott.
Sure.
And that is all for tonight. Before we close, we'd like to invite you to send your comments and suggestions to KQED Newsroom at kqed.org. We really do read all the emails you send, even if we can't reply to all of you. I'm Thuy Vu. Thanks for joining us.
And I'm Scott Schaefer. Good night.